It's pretty sad, but they talk to it, and then also. Just pause it.
I'm going to call this meeting of the Health and Human Services and Veteran Standing Committee to order. We will start with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America, all for which it stands, one nation under God, indivisible, with liberty and justice for all.
Do we have proof of notification? Thank you. We have an 18-point agenda. If someone could approve that for me.
Motion to approve the agenda.
Thank you, Ken. And a second. All right, all those in favor, please say aye. Any opposed? All right, hopefully you all had a chance to look over the previous meeting minutes. Were there any changes? If not, I'll take a motion to approve those.
So moved.
Thank you, Lee. And the second?
I'll second.
Thank you. Oh, mine's on red again. Can you guys hear me? Oh. Does that mean I'm losing battery though?
I think so. If you do, I'll replace them.
Okay, thank you. All right, all those in favor of the approval of previous meeting minutes, please say aye. Aye. Any opposed? All right, number 6 is public comment. Do we have anyone from the public here or members of the committee that would wish to speak as a member of the public? All right, if not, that takes us to number 7, our 2023 VSO budget summary. Ms. Knock.
So far this year, we're still under budget, as you looked at the sheets that are posted. If anyone has any questions, the 2 bills that came through were the conference fees that we attended back in June in Madison.
Should be the number 7s. There's 3 of them. Right.
And just as an update about the Teddy Roof Fund, still no funds from any department have been taken from that. So we're not monitoring the account, but we know that nothing has been touched from it. That's why the sheet's not in there.
Okay, we'll let you do your admin report.
We've had a really good couple of months. We started a huge outreach. We've traveled to Lone Rock and distributed posters with business cards, encouraging veterans to call in. We've done a good percentage of Richland Center. We still plan to hit Ithaca, Casanova, Viola, and hopefully soon we're going to be starting our annual visits to each of the different organizations after we reach out to them to ensure that we can still do that and to make sure that the night, that their meeting is the same and such. So besides that, we're still doing the cemetery office review and adding more veterans into the state database, hundreds a day. So that's all I have.
Any questions from the committee? Thank you, Ms. Knock. Oh, yes.
Karen?
Yeah.
Have we had many new veterans joining or applying for help through you?
Oh, absolutely. Right now we have about 40 to 50 cases that we're currently claims that we're working on with veterans. It's, we've been keeping pretty busy.
Yeah. I was wondering how active the office was with people coming in seeking help.
It's been very active. Our numbers, our daily numbers, there's no being able to gauge ahead of time, like how many, but we get anywhere from 3 to 20 visitors a day.
Thank you.
Did that answer your question, Lee? Okay. Welcome, Don. Good to see you back. All right, if no other questions, we'll move on to the consent portion of the packet. So numbers 9, 10, and 11. You all should have looked over that before the meeting. Were there any questions on those or things from your department that people wanted to speak about?
I was just going to do the contract monitoring. Did you? Okay. So on the contract monitoring report, there are 3 different contracts that we do need to update. So we will be probably bringing those to you next month. 2 of them are placement resources and the other one is a agency in the down in Platteville that we had them complete an assessment and it did go over the contract amount. So those are things that we will be bringing back next month. They're Cholita Forward Home for Boys and Platteville Family Resource Center.
So the Platteville one's not on here. You said
It's on here and it looks like we haven't spent anything on it yet. But we did have a assessment that was completed that went over our,
okay.
went over
Oh, there I
our
see.
contract amount.
Top of page 5. Okay. All right, thank you. All right. Committee, are we good on those or do anybody have questions or clarifications? Oh, okay, then we'll move on to our action items. Number 12 is approve HHS contracts, agreements, and amendments.
And there are none this month.
Okay. Number 13, approve the CST initiative grants.
Just have to make sure you turn your microphone on.
Okay, so we are asking for approval to submit the application and accept for the Coordinated Service Team Initiative Grant. It's up to $60,000 administered through the Wisconsin Department of Corrections, of Health and Human Services, sorry. And it has a $12,000 county match to kind of serve youth in need with complex behavioral health treatment needs. And then this will have to go forward to the board for approval.
So I was trying to remember, have we done this before? Did we do this last year?
Yes.
Okay,
Yeah.
that's what I thought. Thank you, Carrie. Do I have a second? Apologies. Thank you. All those in favor, please say aye. Aye.
Aye.
Aye.
Any opposed? Okay, so number 14, approve the 2024 treatment court grants.
So we are asking for permission to apply and accept the 2024 treatment grant. It's technically called the Treatment Alternatives and Diversion Grant. Last year, we were awarded $173,333 with up to a $43,333 county match to serve individuals in our drug court and our OWI court. The match, it can be in kind or tax levy. Last year, we were able to build into the grant $34,000 of in-kind money and only around $8,500 of tax levy.
Yeah, go ahead, Mr. Ennish.
As we're straightening out the treatment court between the clerk of courts, the sheriff, and you guys, so how was this money used last year versus how you see it being used going forward? I mean, there's a lot of gray areas here right now in the treatment court.
So for now, we're continuing to do it as we have been. We've had some discussions with the judge, quite a few discussions with the judge, and she's happy with the way things are progressing. And so we are making her an equal partner in the respect of before we submit budgets, before we submit the grant application. She's looking at this, she's giving input, any policies that we update, she's a part of, but everything is continuing to run through HHS.
So as we go forward, are we keeping in mind that will a decision we make now affect our inability to get this grant next year?
What do you mean?
Well, if we start changing how we operate or where the monies are coming from, in other words, we take it away from you, can the judge's office or the sheriff or apply for a grant? In other words, I just don't want to see us lose the funding next year because of a decision we make now.
No, we should be okay. Everybody's all on the same page right now that it needs to be funneled through our office. That really brings in the most in kind, which is that match that we need. Per the grant, we have to have so much in match, and in kind keeps us from having to do it through levy. If it went through the judge's office, there would not be as much in kind, and she understands that. Yeah. I think she really brought that to attention because she was worried because it was in our master plan, one of the programs that we looked at potentially cutting. And so I think she brought it to her committee in the respect of she sees the benefits of this program. One nice thing is I think we have about 15 people in the program right now. So that really is, I think, the highest we've ever been. So it's starting to really take off, which is good.
Well, and it's been a great success in the past. We had a presentation a year or two ago, and it was really exciting to hear.
I will still add that OWI court still has a 0% recidivism rate.
Right.
So in 6 years, has reoffended with an OWI.
Right, which is awesome. So I'm very excited about this program, and I really want to see it keep going. Mr. Van Lander.
For those of you that are on the board right now, is this an amount that has been figured into the budget for this coming year so that we're not overstepping everything? That's a part of what we're doing.
Yes, that is correct. We did budget this amount into our budget.
Yeah, I
Yes.
think it's an excellent idea. And if it's not been done, I'll move that we accept it.
Great, thank you. And I'll get a second in a moment. If you look on the cover sheet for it, at the bottom of the cover sheet, it has a little section that says in adopted budget, and they have a check mark by it. So if they ever put forward something, you can see right there whether or not it was in our adopted budget or not, which kind of gives us that information. Okay, do I have a second for approval?
Sure.
Thank you. Any more discussion? All right, if not, all those in favor, please say aye. Aye. Any
Aye.
opposed? Okay, thank you, Brandy. Okay, we are moving right along. Number 15, your director report,
3 times.
right?
So I did submit the unit updates into the folder. If anybody has any questions, I will certainly answer them, but I do want to highlight 2 things. Number 1, we were able to hire a nurse. We're very, very excited. She's starting on the 24th of this month. So it's 28th, sorry, 28th. So we're very excited about that. She interviewed very well, and I think she'll be a great addition to the unit and to the agency. So we're very happy.
So just to clarify, that's public health nurse, not the public, what did we have?
Health specialist.
Health specialist?
Yes,
Okay.
yes.
Awesome.
Yeah, yeah. So we're very, very excited about that. And then we did make an offer this week for our substance abuse counselor position. And so once she starts, this will be the first time since pre-COVID that our behavioral health unit will be fully staffed. So we're very excited about that. A couple of overall updates. Extension continues to be at the community services building. That's going very well. There are no issues or problems that have been brought to my attention. So that's been great. On September 20th, I will be doing a tour of the hospital. As you know, they are looking to build, and I think my understanding is they're trying to do tours to explain what they currently have, what they want to see happen, and really just get some more community engagement. So I'll be doing that on September 20th. And then just want to give you an update on the opioid settlement funds. We continue, I think this last week received another, $17,000. So we're up to about 120, give or take. We have had 2 committee meetings, and it's just people that are both internal county employees, people from the Richland Center Police Department, and then different community members. So we have Partners for Prevention, the hospital, different AODA providers in the community that are all a part of that committee. And what the goal is really to talk about what do we want to do with these funds and then take a proposal to the full county board. We've only had 2 meetings. We're meeting quarterly. Some of the research I've done says, you know, really take your time, do a thorough assessment in this so that we maximize the fund resources. We know we're not going to be able to hire a person, so it's really going to be how do we serve the community in different ways.
Thank you, Tricia. Does anyone have any questions? All right, good news this month. I like it. All righty, so the close to last thing here is review and discuss the 2024 HHS budget.
So just want to kind of highlight this document. Megan's got it up there. Just some things to note. So in administration, you'll see that administration personnel, the total cost has gone down. Just want to point out that that's because a couple of positions have been eliminated. We had Angie Reisner, who was the administration and building manager. When she left, we did not fill that position. And then we also have a one of the receptionists at the front desk. We didn't fill that last year. And so we don't have that budgeted in. So that accounts for that decrease in levy that is needed. In the building and operations, I just want to really remind the committee that that is all the building expenses. So our heat, our utilities, if there are repairs that need to be done, that all comes through our budget. And so I want to make sure that that levy that we're needing for that is to help support the building. It's not to support the staff. Part of it is, but I just want to make sure people understand that we do have to cover those costs of that building through our department. And there are other departments that are in our building that don't help offset those expenses. In our public health, there was an increase in the amount of levy that we need. We just really want to point out that the ARPA funds have pretty much run out. We do have some that we're building in for next year, but overall, there's not those funds there anymore. So the amount of levy that we needed prior to when COVID hit, the amount of levy we needed decreased because we had other funds coming in to help offset that. Also in public health, we did have some savings because we are looking to fill one of the nurse positions as a public health specialist instead of a public health nurse. The other cost savings there that we're having, I know ultimately we're having more levy, but one of the cost savings there is environmental health has been contracted with Grant County over the past quite a few years, and that won't be something that we're doing starting in 2024. They've just found that they're unable to work with all the neighboring counties, and so environmental health will come back in. So the money that we've paid to Grant County and the funds that we get to help support environmental health will just stay within our agency. In the ADRC budget, part of it went up just due to wages. We did ask for an increase in levy in the nutrition program. I want to let you know that the reason for that is the amount of levy that we had requested for 2023 was not sufficient. So we had under budgeted. I think there were 2 reasons for that. One, we really didn't have a good idea of how many meals we needed to serve. When COVID hit, especially in 2021, our numbers went down significantly. When we looked at 2022 and kind of the progression of where we were at, we did exceed that amount in 2020. So the second half of 2022, we served way more meals than the first half of 2022. The last thing that impacted us being under budget and budgeting under the amount that we needed is the dollar amount per meal went up in 2023. So in 2022, we paid $5.25 a meal. In 2023, we paid $6.25 per meal. We didn't find out till after the budget was made that that per meal cost was going up by $1.
Can I add a comment under the ADRC? For the elderly services, I didn't note it on there, maybe something I can do in the future. But elderly services, if you go over to the levy needed, for for that particular line. One thing to note is some of these programs have required match as well. So the elderly services and transportation required match. So the levy in there is the required match. We tried to get that as tight as we could so that it wasn't beyond what was needed in that particular line.
In the economic support unit, we have our maintenance of effort of the 153,272. That is something that we are required to contribute. The rest of the expenses for economic support is covered by the consortium. In child and youth services, we are able to maintain without adding levy to that budget. We do have budgeted one less social work position than what we did for this year, and we are looking to have that full-time family preservation worker instead of the social worker position. Right now, our family preservation worker is through Southwest Workforce Development Board, and we are hoping to transition that to a county position in 2024. In our behavioral health unit, the tax levy that is in that unit is what our required match is. So we don't have any more levy in that unit than what we need to. We are looking to see more increased revenue in the behavioral health unit. We do have 2 full-time therapists that are credentialed. We've really tweaked our process of billing to ensure that we are getting our maximized revenue in regards to the therapists. And so there is an increase there in revenue. And we did remove the CCS supervisor position. Overall, with our budget, we were tasked to create a budget with a 5% increase and a 5% plus a step increase. With the 5% built in and the step, we still came in $76,000 under the levy amount we made from the year prior. So we did what we could to try to bring down that levy amount and give the employees the raises. So what was originally in the budget directives was a 5% increase for everybody. There was some discussion at, I believe, Finance and Personnel, and the decision was made to attempt to give a step increase also for employees. So to give them a 5% pay increase plus go up 1 step on the scale.
It also says at the top, so this would figure in that 13% insurance increase as well.
Yes.
Okay.
Okay, so what we have discovered as well is that our insurance increase is looking at being only 6%. So the preliminary budget numbers that we have been looking at all include a 13%. So there will be some adjustments made. We're slowly working through all of the numbers. We have met with every single department head at this time. And so we will be making those adjustments as well. Oh, yep. And the second year of the surcharge is also relevant in looking at the total cost for the health insurance, because we're in the second year of the surcharge. So that's a reduced amount. And then next year we'll have no surcharge. So.
Great. Questions? Right. Hey, well, thank you guys for putting this together. I know that's a lot of work every time, so appreciate it. Looks great so far. Sorry, I'm just trying to remember. So I know when we had been going through that whole process at the beginning of 2023. Oh, sorry. Is it not on? I'm not close enough. Okay. We had been talking about reducing our placement costs by a certain percentage. Was that still part of the directive after?
From my understanding, no.
Okay.
You know, obviously we're looking to reduce the placement costs, but it's so hard to predict human behavior.
Okay. Anyone else? Or quiet bunch today. Yes. Okay. Ms. Hilashim first.
There you go. Mike's working.
So we're trying to figure out, Don.
Hello.
There we are.
You know, I've been hearing about increased numbers of COVID. Are we experiencing that locally? Do we have numbers? I guess would be my question.
I'm looking to Brandy and I'll let her weigh in on that.
Got a little louder, please. The mic still seems to be working in some cases. Some of us have less than. I know you carry a big stick, but you speak softly.
Okay. Hi, this is Brandy, Richland County Public Health Officer. So we're still monitoring daily for COVID cases. I will say that our county, there is not the number that we've previously seen. We do still receive COVID positive reports. Our main concern right now is monitoring outbreaks, like in our skilled nursing facilities, which currently we don't have. So I would say there has been a significant decrease. I can't speak to as why. I don't know if there's still the testing, the robust testing that's in place, but we still are mandated to still monitor for those. Okay.
Madam Chair. Was last couple of days there, press. Don't think this works. But try to speak up about this COVID area.
Just a moment, Don.
Oh, do I really need a mic?
Yes, for those online.
In the last 2 or 3 days in the press, there's been a lot of discussion about this new COVID variant burgeoning in various areas of the country. And there is some concern. The announcement was tied to the notion that very shortly, this summer, they're coming out with a new vaccine. So I think it's good for us to keep our ears to this, because we certainly don't want a repeat of what we had before, if we can prevent it. It is a case that I feel is urgent and that we need to be attentive to.
Mr. Renish?
Tricia, do you, I'm going back to the building and operating costs, because that's what I do. Do you have a percentage breakdown roughly as utilities, you know, like daily operating costs? Is there anything in there for unexpected repairs or repairs that we're planning on doing, like capital improvements? Can you break down the percentages of costs versus like a slush fund for emergencies versus planned repairs?
I don't think I can break down a percentage. I see Stephanie's doing some digging there, but we have about $6,000 budgeted every year for if one of our HVAC units go out. And then I think we have an additional 3 maybe for random repairs that come up. As far as capital improvements, it's the HVAC system that's the only thing. We have bumped that back another year just so that we can have more time to get a better idea of what would it really entail to do that.
Have you found that $3,000 a year for a building like that is enough to do repairs?
We've been doing okay. I hope you're not
Since the
jinxing
roof
us.
was repaired.
I just,
Before
sorry,
the roof was repaired, it
I
was.
just jinxed you, sorry.
One of the things that we're really hoping for with the new maintenance department, though, is that instead of having to call outside vendors, that Randy can do some of this work. So we are hoping that that will be some cost savings there.
I don't know, did you have anything to add to that? Okay. Lee?
With the money that's added each year to that building maintenance, if there's any left over, does that carry over to the following year so that they've got additional funds in case you have something
It doesn't. It just goes back into the general fund and then we start all
So
over
year
again.
by year, it's, yeah,
Yep.
okay, thank you.
Yeah.
All right, does anyone have any future agenda items? Okay, I think we might almost have a record for our shortest meeting ever. Alrighty, it is a record, if I can believe it. So let's see, our next meeting, 14th, I think, of September. So I will take a motion to adjourn till the 14th at 9:30.
Madam Chair, can I get in the minutes and make that motion?
Yes, and I haven't been ignoring you, I promise. Thank you, Tim. We have a motion from Tim.
Second.
And a second. All right, all those in favor, please say aye.
Aye.
Any opposed? Okay, we are adjourned. You thought who was